I was in the grocery store and a woman came up to me and introduced herself as Ellen. Dr. Vinio, can you talk about carpal tunnel syndrome? I'm afraid to have surgery. Sure thing, Ellen. The carpal tunnel is a very tight passageway in the wrist on the palmar side of the hand. 9 tendons in the median nerve travel through the carpal tunnel, and the transverse carpal ligament goes over the top of them. There's no room for any swelling in there, and everything pushes on each other, and this puts pressure on the median nerve. The median nerve provides sensation to the thumb, the index finger, middle finger, and half of the ring finger. If it gets compressed long enough, the thumb and those fingers can get tingly and numb or clumsy and can cause achy wrist and forearm pain. Carpal tunnel syndrome is the most common nerve entrapment problem, affecting about 1 in 25 people. It is more common in women between 40 and 60 years of age, but can affect anyone who does lots of repetitive movements. Other risk factors include being over 30 years old, obese, pregnant, and having a family history of similar problems. Rarely is any one factor pinpointed, and it's usually several factors together. The most definitive test to help detect carpal tunnel syndrome is an electromyogram, or EMG. This test sends a small electrical signal to test nerve conduction and muscles to see if the nerve is sending proper signals. The first treatment is usually wrist splints every night for 1 month. Many people flex their wrists at night, put them under their pillow, and dream about Patrick Swayze, and that puts pressure on the nerve as it passes through the carpal tunnel. I always tell patients they can wear the splints during the day, and maybe someone will buy them a cup of coffee, but the main benefit is during sleep. Movements that aggravate the symptoms should be avoided if possible. Typing is often one of the things that makes carpal tunnel syndrome worse, and ergonomic keyboards can be very helpful. Diuretics or water pills can be used for 2 weeks to help decrease fluid that can build up and make the pressure on the nerve worse. Non-steroidal anti-inflammatory medicines such as ibuprofen can be very helpful. These medicines should be avoided in pregnancy. Staying with the wrist splints is probably the best idea. If those measures don't help, the next step is often a steroid injection into the carpal tunnel to calm down inflammation. Most patients get relief from steroid injections within the first month, and some may benefit for several months or longer. Usually, if more than 2 injections in 12 months are required, the next step is surgery. The transverse carpal ligament is cut during the surgery to release the pressure on the median nerve. It's not a big operation. Talk to your provider about treatment options soon, because carpal tunnel syndrome can be harder to treat if it goes on for too long. And remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vinio, and this is Health Matters.